welcome everybody. I'm Jeremy Adler. I'm the interim director of the Susan B. Meister Child Health Evaluation and Research Center in the Department of Pediatrics. I'm really delighted to welcome everyone to the lecture today. This is the 16th lecture in this series. I'd like to start by extending a special welcome to our keynote speaker, ADRIANNE TODMAN, Acting Director of the U.S. Department of Housing and Urban Development, and our four panelists, Jennifer ERB-DOWNWARD, Dr. SARA ADAR, Dr. CARLA O'Connor, and Dr. ALISON Miller, whom I'll introduce in a moment. Before turning the program over to our keynote speaker and all our speakers, I'd like to take a moment to recognize an individual who's really been instrumental in the development and the evolution of this lecture series, and to announce the recipient of our Best Paper Award in Child Health Policy. First, I'd like to acknowledge Dr. Susan Meister and her vision for supporting this lecture and for supporting our center. The lecture is named in honor of Dr. Meister, an accomplished child health policy researcher herself. She recognized the value of an interdisciplinary center for child health services research and policy at Michigan early on. And for the past 18 years, she's provided crucial support and partnership to help develop our center. Her inspiring commitment to multidisciplinary research is what launched this very special event today. Our center sponsors this lecture every year, aiming to engage an interdisciplinary audience in a conversation about pressing issues that call for an interdisciplinary response. I'd like to take a moment to recognize Dr. Meister and her tremendously valuable role. Dr. Meister. Okay, thank you. Sorry about this. So next, I'd like to announce the paper award winner. This prize has been established to recognize an outstanding scientific paper in child health policy by a student or postdoctoral fellow at the University of Michigan. Nominations are evaluated with respect to contribution of novel methods or expanding knowledge base about significant clinical or public health issues. The quality of research and the policy implications are also considered. Today, I'm pleased to announce the 2023 recipient of the Best Paper in Child Health Policy, Dr. Meredith Petty, for her study entitled Randomized Design Evidence of the Attendance Benefits of the EPA School Bus Replacement Program. Dr. Petty, thanks for somewhere. Dr. Petty received her MPH and PhD in Epidemiology from the University of Michigan School of Public Health, as well as a master's in Public Health Policy from the Gerald R. Ford School of Public Policy at U of M. She just completed her postdoc and is now a research scientist in the Department of Epidemiology in the School of Public Health. Her study used data from nearly 2,400 school districts across the U.S. that entered into a lottery for funding from the Environmental Protection Agency's school bus rebate program. And that was randomly allocated. The funds were randomly allocated to different school districts and were to be used to replace old diesel-powered school buses with newer low-emission buses. She found a substantial benefit from attendance where the buses were replaced, and there was no improvement in the other school districts. The study was recently published in Nature Sustainability and found that the new buses resulted in an increase in over 350,000 student days of attendance. And there were also improvements in educational attainment in reading, language arts, and math. It really, truly is a remarkable and impactful work. So I'd like to invite Dr. Petty up to the podium to receive her award.
Thank you so much. Thank you.
Watch your step. So congratulations, Dr. Petty. Okay, so I'd also like to take a moment to comment on the interdisciplinary focus of this event. A key goal of this lecture series is to bring people together from across the university and from the broader community to discuss issues in child health policy that cross disciplinary boundaries. Our topic today, the impact of neighborhoods on child health, brings together attendees from a wide range of background with students, faculty, and alumni from across 16 schools and colleges within U of M, and from the broader community, including experts in healthcare, housing, and policy. This year's theme is of great importance. Neighborhoods form the background of our society, and they form the environment in which children grow and learn and develop. So many aspects of neighborhoods impact child health, from access to healthcare services, to the presence of green spaces and playgrounds, to pollution, to safe and stable housing. All are important for providing for a healthy and secure childhood, which has long-lasting implications into adulthood. It is exciting to see everybody here today. All of your presence is a testament to how important this topic is. It's so valuable to have events like this to spark new conversations and new thinking in the intersection of disciplines. Welcome to everybody, and thank you for joining in the conversation today. We have an incredible panel of speakers today, each providing their own important perspective on today's topic. I look forward to an engaging discussion at the end. We will begin with a presentation from our keynote speaker, followed by brief remarks from each of 4 panelists. And then we'll have time for a Q&A, and we'll include both questions from the audience as well as questions that have been submitted ahead of time. Excuse me. Now, it is my great pleasure to introduce our keynote speaker, ADRIANNE TODMAN, the Acting Secretary of the U.S. Department of Housing and Urban Development. Secretary TODMAN has a long and distinguished career working in the housing space. She's worked as the Executive Director of the District of Columbia Housing Authority, where she implemented an award-winning model to house homeless veterans and implemented programs which improved homeownership for low and moderate income families. In this role, she prioritized youth and repairs to housing units. Then she joined Housing and Urban Development, where she started as a manager administrating housing grants and served in several other positions before being confirmed by the Senate to the position of Deputy Secretary in 2021. Her role in HUD, in that role, she's worked for confronting housing insecurity, increasing the presence of nation's housing supply, eliminating housing discrimination, and supporting community resilience, particularly in response to natural disasters. She's recently been appointed the Acting Secretary, the highest ranking official in the U.S. Department of Housing and Urban Development. So it's truly an honor to welcome Secretary TODMAN today, and I look forward to hearing her perspective on the impact of neighborhoods on child health and opportunity for better policy. Secretary TODMAN.
Well, good evening. Good evening, everyone. Hello. I know it's cold in Michigan, but come now. It is fantastic to be here and wonderful to be with all of you. And I thank Dr. Adler and the faculty and staff at this tremendous center. I didn't even know this center existed until I received the invitation. So I am just thrilled, not just to be here, but most importantly, to now know about your fabulous work and the work that you're doing to inform policy across the country, which you are. I did look it up. You know, when I accepted this invitation, I was serving solely as the department's deputy secretary, which was in and of itself kind of a big job. The deputy secretary functions as the COO of the department, making sure that the train's running on time and everybody's doing what they're supposed to do. And it's been 2 weeks now that I've been the acting secretary of HUD. So as you can imagine, my days have changed just a little bit. But it was important for me to still be here with you here to not just talk to you about HUD's lens on children's health and the intersection of our work to that end, but also to hear more from you all about what your research shows. So I'm truly looking forward to the panel that will share their thoughts right after me. You know, as someone who's been a housing practitioner for most of my career, I've always relished and envied the work of researchers. You know, when you're a practitioner, you really don't have the luxury of always stopping and pausing and thinking. You are in constant on mode. And so I've tried to, over the past 25 years of my career, to just sit back and allow researchers to come in and evaluate my work and say to me, here's what you could be doing better. And not taking it personally, but understanding it's about whether or not the outcomes we hope to achieve are actually being achieved. So I am in awe of you in many ways and look forward to our future collaboration together. You know, earlier today, I visited an affordable housing community that is not too very far from here. And I had an opportunity to meet a lady named Ebony and another named Samantha. I told them this moment would come. Didn't I tell them, Team HUD? I said I would mention this moment. And these are two moms who really are thrilled with the new homes that they have from the Ann Arbor Housing Commission. One of them had been doubled up with their family. Another was, had exited the shelter system here. One had a 2-bedroom, the other had a 5-bedroom. But the one thing that they certainly shared in common was their enthusiasm for the fact that they were able to provide a stable shelter for their children. And I was thrilled for them as they talked about, as the kids were choosing their bedrooms and the different things that they wanted. Many of us who have had stable housing for all of our lives and been able to provide stable housing to our children or grandchildren, it is always healthy and important for us to live a little bit in the lives of people whose stable housing may have just started yesterday, maybe a week ago. In the case of Ebony and Samantha, 3 years ago and 18 months ago. And I know that's why I do this work. It is fundamentally why I do this work. While I thrive on policy, I enjoy the operation of things, at the end of the day, it is being amongst folks who you're truly helping that really makes a difference. And I think of their children, and I think, just imagine that, happy, thriving kids. I know that here at the center, you seek to achieve that through research and policymaking. At HUD, we look to do that through affordable housing and sustaining resilient communities. So 2 weeks ago, I did tell you I got a new job 2 weeks ago, didn't I? 2 weeks ago, I was with the president when he shared his vision on housing policy. And let me say this about that. I have been in the housing ecosystem for a very long time. And it is rare to come across a president who takes the time to actually talk in a very strong and meaningful way about a housing vision. There's many favorite presidents that I've had in the past, but I will say as a fact that this was a moment that I had not seen during my career. So it was wonderful to be there and hear what he had to say and know that it's the HUD team that's going to be playing a critical role in carrying out that vision. And one of the things that he said that resonates with me, and I'm sure many of you, it's not just about the housing. Housing's critical. It is fundamentally about the people. Our agency, HUD, we directly serve more than 3 million children under the age of 18. We have a unique responsibility to ensure that they, as well as every child in this country, can grow up in safe and healthy housing, that they can live in nurturing neighborhoods that set a solid foundation for their future. I know that's what every parent wants for their child. It's certainly what I wanted for my 28-year-old daughter when she was younger. And we know why this all matters. Cycles of poverty continue in neighborhoods where there is limited access to health care and healthy foods or jobs. And this isn't just in urban America, it's rural America as well, where housing instability may sometimes look different, but it is there nonetheless. And housing instability is stressful and has lasting impact on a person's and our children's well-being, and not just their physical well-being, but their mental well-being as well. I read the other day, and maybe I'm sure some of you here had a hand in some of this, but I read the other day that there's a happiness scale. And this year, it looks like some of our young adults are not feeling well, that they are going through different levels of stress and sort of some type of mental well-being that's not stable. So we know our work is cut out for us to make sure we're doing everything we can with all of our levers to help them thrive into their adulthood. One of the things that I know is that in many cases, HUD's programs can fill critical gaps that keep families safe. For instance, a recent study from Columbia University found that people who live in public housing face less exposure to lead than their counterparts who more heavily rely on the private market. That may seem counterintuitive, but the folks in Columbia said so. So today, with that in mind, I want to talk to you about the housing work that's really making a difference in people's lives as we at HUD address homelessness, as we support renters, as we try to make housing, the built environment itself, healthier, and we try to make neighborhoods stronger. Look, it's no question that we need to address homelessness in this country with the urgency that it needs. Last year's homelessness count, we call it the point-in-time count. It happens every year in January or February. It increased over the January 2022 to January of 2023, including numbers of our youth homeless population and families with children. But we've been targeting our resources because we saw the trends coming, and by we I mean HUD. In fact, over $400 million has been provided to over 100 communities to intentionally take on youth homelessness. And there's another $72 million that we plan to put out this year. We're providing rental assistance to youth aging out of foster care. I mean, I mentioned my daughter, who of course I believe is brilliant. But I try to think about her or anybody else's child who at 18, 19, 20, in this day and age, you're basically told, good luck. Good luck out there. Good luck finding your first apartment. Good luck figuring out how to do grocery shopping. Good luck figuring out how to pay bills. We have youth aging out of our foster system where that is what they're experiencing. So we know that. And so what we've tried to do as the housers we are is to try to at least create stability in their housing as they figure out adulting. And we have a brand new program that's tied just to them. In fact, one of the things that we've done over the past couple of years under the heading of housing stability is we've provided more rental assistance to youth, to seniors, to veterans, to families than any other time over the past 20 years, because we understand the very critical intersection between housing and healthcare and what that means, but also housing in terms of creating a thriving, promising future. Earlier this year, we awarded the largest ever allocation of homelessness assistance funding in history, $3 billion to help what we call our continuums of care. And these are the nonprofits. Anybody here ever worked with a continuum of care, a COC? These are the nonprofits who I think do a heavy lift. These are the ones who work every single day tracking down our homeless neighbors, making sure they're filling out the right paperwork, trying to get them off the streets, trying to get them into housing, trying to provide them with the services and care that they need, including all the children that we care so much about. We provided them with funds so they can do that amazing work. We know that to solve homelessness, we have to make sure people can access not just housing, but healthcare and all the other supportive services that they need, so they don't fall back into the same cycle that left them without a home to begin with. Unfortunately, funding for services can also be unstable and makes it hard for communities and providers to deliver the help that people genuinely need. For years, experts have been thinking about how can we use Medicaid, something I know many of you here are familiar with, Medicaid to cover housing-related services for people who are experiencing homelessness. I know that 2 jobs ago, I tried to do this, right, and reached out to our healthcare system in Washington, D.C., and I was on the housing side of the ledger. Not only did we try to figure out how to grade our programs, we were also speaking 2 entirely different languages. And we realized we needed an interpreter, almost a whisper on each side, so we can learn how to move forward together. Some of that work has happened incrementally across the country, but one of the things that we did, and I was proud to make this announcement with Secretary Becerra and our sister agency, HHS, is we've stood up very intentionally an initiative to work with 5 or 6 states across the country where we will, housing and HHS, hand in hand, go work with them through both our systems so that they can be able to provide individuals who are homeless with housing supports, with perhaps a little bit of money for rent, through the Medicaid waiver that the states have received. And we're hoping to really have a community of practice and look to lift up all of the promising actions that they took so we can replicate it across the country. Just for context, the annual Medicaid spending is over $800 billion, and HUD's budget is a quarter of that. So we certainly don't intend to take away healthcare money. That is not the case at all, nor could we. But the idea is, how do we find a way to have our systems work together so we can house families in a way that's sustainable? You know, this partnership will really teach all of us about a system change that I think is a long time coming. And it's the realization of a promise that was long made, a promise that we would do everything we could to work across the government to address homelessness with care. I'll switch over a little bit to what we're doing for our renters. I know at HUD, we provide rental assistance to 2.5 million Americans across the country. It's our largest program, and it really plays a crucial role in keeping families stable. But it only works when we're able to use our rental assistance in the private rental market. Last summer, one of the things that we did in recognition of the fact that rents were rising all across the country was we increased the value of our vouchers to keep up with some of the market rents, to make sure our low-income families were able to rent in units in neighborhoods where they wanted to live. And we also provided housing agencies more flexibility to help families find apartments and willing landlords. Lead reduction. Once we have housed families, we want to make sure that the units that they are in are safe. And we have a responsibility to do that. As many of you all very well know, here in Michigan, hazards like lead and radon and other toxins are detrimental to the health and safety of residents, especially our children. And I know folks across the state have been working tirelessly to eliminate the threat of lead. At HUD, we are proud to give state and local governments the resources necessary to remove lead-based paint and other hazards from homes. In fact, this year marks the 25th anniversary of HUD's Healthy Homes Initiative. And, you know, I was thinking about that, and I was actually at HUD. I realized when it started the Healthy Homes Initiative, which, you know, made me feel a little ways, but such is life. But we're excited that we were able to not just provide folks with affordable housing, that we were making sure that that housing was safe and lead-free. And this year alone, we've been able to provide $340 million to address health hazards. And we look forward to awarding more Healthy Home grants later this year. And this means that more than 1 million children have had a chance to grow up healthier because of this funding. You know, we are a key partner in the entire Federal Families Lead Pipe and Paint Action Plan. And this is a whole of government effort to eliminate all lead, to eliminate all lead service lines and address lead paint issues across the country, especially in low-income and minority communities. We're working alongside our partners at EPA, at CDC, Department of Energy, and it's a strong partnership. I know that the deputy and now the administrator at EPA, we work very closely with each other to make sure that their funds and our funds are braiding well in the local communities that we serve. And our investments are just a down payment on the future of our communities. We estimate that our programs have delivered a net benefit of about $200 billion to the country. One other thing that we've worked on as we try to make sure we're improving the condition of health of our children through the tools that HUD has is our new INSPIRE protocol. What INSPIRE is a 5-year labor of love to fine-tune our inspection of units across the entire HUD portfolio, both our public and privately assisted, HUD-assisted units, but our voucher program as well. You may not believe this, but before then, there was different standards for each one of those programs. And what we did was take a hard look at what were we measuring and why were we measuring it. And the old standard really focused on appearance and curb appeal. And we've shifted our attention to inside the unit to make sure that the hazards I talked about do not exist. And these are routine checks for fire safety, carbon monoxide, mold, drinking water, and lead-based paint hazards. And truly, our goal is to ensure the current and future residents of the homes that HUD provides subsidy for are safe, and that people feel good about where they live. You know, at the end of the day, one of the things that we all know is housing is healthcare. But we need more housing. We just fundamentally need more housing, and we have inspection protocols, we have our current rental assistance, but we fundamentally need just more housing. As I've traveled the country, whether I'm in a big urban city or rural county somewhere, affordability, like I said, may look different, but it's certainly something that folks want us to address. And it's one of the things that, HUD is pretty good at. So one of the things that we've done over the past couple of years is work very closely with mayors, with governors. We've had a whole community of practice of how to use HUD's resources and other agencies' resources to just simply build more units. And we've been able to get at least 1.2 million units sort of financed and shovels in the ground. And over the course of this next year, we're expecting many more. It's been a tricky economy for us because of interest rates. We did not, for understandable reasons, given the trickiness of financing new construction, interest rates kind of slowed down some of the progress that we wanted to have. But we have many other programs in place to try to fill those gaps as we're waiting for an environment where our housing developers and builders are having lots more starts than they did in 2023. One of the ways we're doing that is through our budget, our proposed budget that we provided to Congress 2 weeks ago, maybe 3 weeks ago. And what we're doing is something that is unique. So there is a mandatory side of the budget, and there is a discretionary side of the budget. The discretionary, all you Gov 101 majors, anybody? Nobody? Okay. On the discretionary side of the budget, it's sort of like, maybe gets money, maybe it doesn't get money, people, sort of go back and forth about what the right point should be. On the mandatory side of the budget, it's just that. It's mandatory. So our healthcare system, as many as you know, sits inside of the mandatory side. Our housing sits on the side of the discretionary side. So one of the things that we did, starting actually last year, was we decided, you know what, if housing is healthcare, we got to put our funds on the mandatory side of the budget. And we did just that. We've proposed billions of dollars of investment that we know we all need, particularly here in Michigan, to make sure that we are helping not just our homeless brothers and sisters, but that we're helping first-time homeowners as well who are looking for that starter home. In fact, one of the things that we did very recently through the American Rescue Plan was provide $151 million here in the state of Michigan to help with that investment in the housing ecosystem. But we know we need more. And that's why we're fighting every day to make sure that the resources we need for this country, the resources we need from our partners in Congress, that we're able to move forward with it and get the dollars we need for all the programs that we administer. You know, one of the things that I've enjoyed the most about the work that I've done in housing is truly been inspired by the power of children. I was talking to a group not too long ago, and they mentioned to me, what keeps you going? You wake up every day, you try to get something done, you have a hard day, you have the people at the White House beating you up. That's not true. You're good people. You're dealing with your crazy staff. How do you actually, wake up the next morning and feel empowered and energized to continue the work? And this is kind of corny, but I have this picture in my office. It is a picture of, back in 2010, a picture of me and a 3 or 4-year-old little boy, and he's on his little tricycle, and I'm just kind of, scooched down so we get eye to eye. At my height, that's not very hard, but we get eye to eye. And it's just him sort of looking at me with, as sternly as a 3 or 4-year-old can look at one. And the reason that I have that picture on my wall, and I've had it there for this job and certainly the job before this one, is he was a little boy who lived in the oldest public housing site in DC. And I look at that picture and I say to myself, I don't know if that little boy is dead or alive because of his zip code. I should not, in this great, powerful country of ours, ever have to wonder whether or not he's thriving. But I do wonder. And so I look at that picture every morning and I say, I'm going to try to do everything I can with this day that I've been given, to do everything I can to make sure that other 3- and 4-year-old boys, just like him, always have a thriving community to live in, so no one ever has to wonder what their promise is. And that's what keeps me going. When I was invited to speak here, I was like, this is a great invitation, but seems odd. But I realize it's really an opportunity for me to express in a group of people who care deeply about children's health, how a houser is standing with you in that work. I think the intersection between housing and healthcare, but narrowing it down to housing and the caring of children, is one of the most important things we can do as adults. It absolutely is. Because if we can't do it with the brilliance and the resources that we have, how can we be a beacon to others across the globe? I have hope, and I feel the promise, even in this room, of our ability to achieve that. I know that HUD is doing everything it can to do that. And I know that you are doing everything you can at the center and with the young minds here at the university to do that as well. I want to thank you for the opportunity to be able to share this space with you. And I look forward to our continued partnership with your research, helping to drive questions and make policy recommendations for the work that HUD does every single day. Thank you for the...
Thank you very much, Secretary, for those very thought-provoking remarks. Excuse me. Next, I'm delighted to introduce our 4 panelists who are going to be joining us. Our first if you'd please come up and join us on the podium. Our first panelist will be Jennifer ERB-DOWNWARD, who is the... I'm going to introduce everybody, and then we'll call them up one at a time. But you can come up and have a seat, of course. Thank you. Okay, our first panelist is going to be Jennifer ERB-DOWNWARD, who is the Director of Housing Stability Programs and Policy Initiatives at Poverty Solutions at the University of Michigan. Her work focuses on the intersection of housing, health, and education with an emphasis on cross-system collaboration to support vulnerable children. She's been influential in informing policy at the local, state, and national level, much of it aimed at supporting vulnerable youth. Our second panelist will be Dr. SARA ADAR, who is Associate Chair of Epidemiology at the University of Michigan School of Public Health. Her research focuses on the impact of the environment on health across the aging spectrum. She mentored Dr. Petty in her doctoral and postdoctoral research, including the work on the bus project we spoke about earlier. And our third panelist will be Dr. CARLA O'Connor, the University Diversity and Social Transformation Professor, and Arthur F. Thurnau Professor of Education at the University of Michigan. She also directs Wolverine Pathways, a University of Michigan college preparatory program serving underrepresented youth in Michigan. And then our fourth panelist will be Dr. Alison Miller, who is a developmental psychologist at the University of Michigan School of Public Health, and whose work focuses on how social determinants of health and adverse childhood experiences impact health outcomes. Each of the panelists will make a brief set of remarks, and at the end, we will open up the panel for discussion. So please join me in welcoming our first panelist, Jen ERB-DOWNWARD.
Thank you so much. And first, I just want to start off by thanking your acting secretary, TODMAN. It was really inspirational just hearing, one, what gets you up in the morning, and just hearing how closely connected you are to the work that's being done at HUD and to the community members that are being served. So that was just amazing. So I guess to start off with, I just wanted to touch a little bit more around housing instability and give us a sense of what that looks like in the United States right now for children. And we already talked a little bit about what that means from a health perspective, but just to go over a little bit of the work that's being done at Poverty Solutions. So in the United States, on a given night, there are roughly 108,000 children who are experiencing homelessness, who are living in the shelters or on the street. And that's based on the point-in-time count that was referenced earlier. And this is a very large number. It is far, far too high when we think about the importance of housing to the health and well-being of a child, but really is an underestimate of how many children are experiencing instability in housing and the scope of the issue that exists in the United States right now. Every year, 1.5 million children are evicted in the United States, and close to 3 million children experience homelessness as defined by the Education Department, which includes families like one of the families that was referenced who are living doubled up or couch surfing due to economic hardship or loss of housing. So that is just in some ways, it's a number that it's hard to wrap your head around, thinking about what that means right now for our children growing up. At a more local level, and just to give context to think about what this means over the course of a child's life, we know in Michigan, 1 in 10 children experience homelessness during their K through 12 experience. And because of systemic racism in our housing and economic structure, we know that number is much higher for Black and Hispanic children, where 1 in 7 experience homelessness by the time they're finishing or leaving high school. So this has a lot of different health implications when we think about this, from mental and physical health to developmental milestones for young children. All of these we see in the research that we've been doing over the last 7 years are impacted. At the health level, there's a chart in the corner there that's looking at the Youth Risk Behavior Survey data for Michigan. And in the dark blue, I know it's a very small chart, but the main takeaway it really is in the dark blue, you see the outcomes for children in high school who report that they've experienced homelessness just in the last 30 days. And they have significantly higher reports of adverse childhood events, 3 to 4 times the rate of reports of attempted suicide, sexual assault. And then if you look across that survey, every single indicator that is available, students who are experiencing homelessness during high school, they're struggling more. And it is having a lasting impact on their health and well-being. This is also true educationally when we look at children. They're missing more school, they're struggling more to graduate, and we know this is not because of ability. This is because of the situations that they are placed in, because of the lack of stable housing that they have. And we also know from looking at these numbers in the work that we've been doing that these impacts are lasting unless we do things to provide additional support in our communities to children who have experienced homelessness. What we found is that even after stable housing is provided, that many of these impacts are continuing on, and formerly homeless children are often struggling just as much in school and with their health outcomes as children who are stably housed, or as children who are currently homeless. So thinking about how as a community we can both provide more housing and wrap our arms around children who have had this experience is a really critical thing. We were asked to talk a little bit about how health care centers can really, where we can engage. And while there are many, many different policy levels that are needed to tackle the current issues around housing instability for children, and many of these were addressed, which was just exciting to hear. The one I wanted to focus on right now for this room is that health centers are very, very well placed to identify children who are experiencing housing instability. The 2 places that you can almost guarantee that a child will go and a family will go are school and the health care system. And particularly for those young children who are under the age of 6, the healthcare system is almost the only place that you are guaranteed to find families with children almost universally. And there is an opportunity that really exists here using social determinants of health screeners, which are being applied and implemented throughout medical centers and pediatric practices, to think about how we can use those and intervene using the hospital, not as just a medical facility, but as an anchor institution. How can we make our centers something that will connect families to the resources that they need, recognizing that housing is health. Housing is health, and it is a fundamental right that every child, every person should have. And so one of the questions that we are looking at right now, we're working with the PEACH program, Poverty Solutions and the PEACH program are collaborating right now, and looking at how this question of housing stability is being used in the screening process. So there's a question that basically asks whether or not a family feels that they are at risk of losing their housing, their rented, shared, or owned housing the next few months. And our goal with this project is to, 1, figure out how many families are responding to this question, and then to look at that and see what's being done with these referrals. And from there, ideally to develop a pilot where we can improve whatever supports and resources are being implemented now and strengthen those with the surrounding community. I'm going to stop there, but thank you all very, very much. And I look forward to a very interesting and lively conversation.
Wonderful. I have to lower the mic. First off, thank you so much, Secretary, for your really inspiring remarks. Thank you, Dr. Meister, for sponsoring this really wonderful event. And thank you to the organizers for having me. I'm really delighted to be here today to bring a little bit about environmental health to this conversation. I'm going to be focusing a bit on air pollution. We heard a lot about different environmental hazards that folks experience in their lives. My work really does center predominantly on air pollution. So what is air pollution? Well, it's these particles and gases that we breathe in every moment of our lives as obligatory breathers, right? From the moment we're born until we're done with our lives, we're breathing these in. And just like you think about the toxic contaminants we breathe in with cigarette smoke, ambient air is admittedly less polluted than what you would get from a cigarette smoke, but we expect similar health effects from those exposures as we do to cigarette smoking. Children are particularly sensitive as they are developing still in their bodies, and they do actually breathe in more air per their body size than we do as adults. One thing to note is we heard that zip code really matters. These exposures are not the same everywhere. And here in the United States, it's been estimated that about 1 in 3 US folks experience levels of air pollution that are considered to be unhealthy. And that's, when you look at the number of children, we're talking about 27 million kids living with these levels of unhealthy air pollution. Now, our predominant lever for improving the health of kids in our neighborhoods from air pollution is with the Clean Air Act. Our national ambient air quality standards are very effective in reducing exposures and improving health. But many of you have noticed we had wildfire smoke events. Some communities still have high exposures, and so there are these other alternatives that you can go into homes, you can intervene in the housing in order to improve exposures. We're not the only ones to look at air purifiers as an option, but we did go into some affordable housing in Detroit, install these air purifiers that were relatively inexpensive, and found that that was indeed an effective means to reduce exposures to families. Now, at home is one way that people do experience environmental hazards, but it's not the only way. And here in the United States, we have 25 million children who commute each day to and from their homes, right, in their own communities, to school riding these big, beautiful yellow school buses, which is great, but our fleet, I should say it is a wonderful thing from a traffic safety perspective. This is a very safe way to get to school. But our fleet is actually quite old here in the United States. And what that means is that many of our children are riding buses which still have very high exposures to air pollution inside those cabins. And so for many of our children here in the United States, they're getting a huge fraction of their daily exposures to air pollution just by getting from home to school each day. Now, I'm the eternal optimist, so every time I tell you about a problem, I'm going to tell you about a possible solution. The good news is we do have clean air technology that has been coming into our bus fleet. The EPA has really required changes to have things cleaned up. And what's wonderful is we've done research. This study is here from over 400 kids that we followed out in Washington State, where we demonstrated that when investments were made in communities to purchase new school buses for those school districts, kids had lower levels of air pollution on their rides to school. They had less inflammation in their lungs. They had better lung function, and they were less likely to miss school when they were riding those clean buses. You heard very briefly early on, Meredith Petty did a really nice study to ask the question of how does this hold up for the national scale. The EPA has actually provided a source of funds, a lottery system by which school districts can apply for money to replace their school buses. And as we heard a little bit of a preview earlier on, Dr. Petty found that this was a highly effective way to improve children's attendance. So again, if they're feeling better, they're attending school. She also found that there was educational performance increases in the districts that got, the money for new buses as compared to other districts. And we also saw improvements to outdoor air pollution in the communities at large. So that was a great benefit. Just a quick note, we tried to, extrapolate out. The oldest buses are really those buses we want to get out of the fleet. If you replace the oldest 15% of our buses, we're talking about an estimate of over $1 billion per year in economic benefits that we estimate just based on the improvements in attendance of kids alone. Finally, before I just wrap up, I want to say, one other option by which we can improve kids' health and their exposures to environmental things is not just cleaning up their buses, but actually making it easier for them to use active transportation. I think I don't have to tell everybody that that it's going to be healthier for you to be biking, to be walking, all of those things, as opposed to sitting in a highly polluting, traffic jam. And we do indeed see, right, if you were able to make communities that had walkways, that had easy access for people to do active transport, we would have better health in our communities and with our kids. So with that, I will conclude with a quote of optimism like the rest of this team, which is why I'm so delighted to be here. I think there's many different ways that we can try and improve kids' health through the environment. And so I welcome anyone to email me later if you want to talk.
Good afternoon. So I may be the odd person out. I don't study child health. I study youth and urban communities, particularly related to education. And what I'll be doing is thinking about how the logics I use to think about young people's educational resilience, particularly low-income African-American students' educational resilience, how that logic should be or could be applied to how we think about public health. And public health, particularly with neighborhoods and children. So clearly the discussion so far having us think about geography of opportunity, right? And how where you live matters to your life outcomes. And when we're thinking specifically about geography and health, and particularly children's health and neighborhood effects, more specifically, research has almost exclusively equated neighborhood quality with SES, and especially focused on urban areas. And though there's been increasing attention to rural communities and the extant variation in conditions, including the housing differences within poor neighborhoods, observed or perceived, the research remains near laser focused on the health risks of growing up in low-income environments. And I want to read two quotes from the field that provide more gross illustrations of this orientation. The first one is from a 2017 article by Zuberi and Texeria in the Journal of Community Psychology. They indicate, low-income neighborhoods have many features that may impede children's health, including exposure to community violence, frayed social networks, and disorderly, chaotic environments. All of these stresses can compromise residents' immune systems, leading to poorer health outcomes among children and exacerbating chronic health conditions. Another from a 2021 article in Academic Pediatrics, they indicates family and neighborhood living conditions can have lasting consequences for health, with community adversity affecting health outcomes in significant in part through stress responses and increased allostatic load. Exposure to this toxic stress influences gene expression and brain development with direct and indirect negative consequences for health. Ensuring healthy child development requires improving conditions in distressed, high-poverty neighborhoods by reducing children's exposure to neighborhood stresses and support good family and caregiver functioning, right? And because I have little time, I won't use these excerpts to elaborate upon the gross generalizations and deficient assumptions that are being made about what life looks like in poor neighborhoods. The increasing work on variation within and across poor communities is beginning to chip away at that. Instead, I want to draw our attention to the extent to which these a priori assumptions are less problematic when we are attending to children's health outcomes that are more objective and can be readily attributed to structured disadvantage in poor neighborhoods that is itself a function of histories of discrimination and inequality that disproportionately affect people of color, right? So we know due to race and power that animate exclusionary housing policies, concentrated housing inequities, and enforcement or not of environmental regulation, that poor communities are often exposed to a range of environmental hazards because of where they sit and what sits next to them, right? Whether they're near incinerators, chemical waste dumps, waste disposal sites, densely polluted air, lead exposure, biological waste from industrial farms, et cetera, right? And what that means is there are biological and environmental factors, organic causes that produce negative health consequences, right? You either have asthma or you don't. You either, due to lead exposure, now have substantial cognitive impairment that is recognizable and doesn't require inference, or you don't, right? There are a range of health consequences that are more objective and less inferential that are tied to clear environmental hazards that are tied to neighborhood. Things become more complicated, though, when you're dealing with health issues that are more inferential. So mild cognitive disorders, mental health issues, and the like. And the way urban or low-income environments are framed are problematic in these regards. And you could just think about some findings. For example, the finding that we find that often African Americans are actually more healthy in low-income neighborhoods, which are predominantly minority, than in affluent neighborhoods. The fact that if you a study in Chicago looking at Puerto Ricans and Mexican Americans found that actually Puerto Ricans was thriving in segregated communities while the Mexican Americans were not necessarily thriving in their communities. The fact that when we think about suburban context, there is a lot of indices of adolescent lack of well-being, high drug use, high records of mental health disorders, but we're not examining what might be unhealthy about those environments and why are some children less healthy in those environments. And so this is just a long way of saying that if in fact we're taking seriously what does it mean, what are the relations between neighborhood effects and children's health, we have to understand that there are assets that go understudied in these very low-income neighborhoods that actually provide a source of strength and capacity for young people, and simultaneously there are really deleterious effects in neighborhoods we imagine as environments that are healthy and striving for young people. And if we're thinking about analyzing children's wellness as a whole, we have to engage our analysis of these communities in much more complicated ways. Thank you.
All right, thank you so much. And I love all of these talks. I'm so happy we're all here. And thank you, Secretary TODMAN and everyone on the panel and Dr. Meister for allowing us to just focus in on these issues today. I know we've covered a wide range of topics and I'm gonna even go broader, but hopefully dive into maybe touching on almost all of the issues that have been mentioned so far and also parents. So, can I go? Yeah. Okay, so context of early development, how we can think about how neighborhoods kind of get in and shape child health, social determinants, as we say in public health, around the neighborhood. So we've heard already that young children are deeply shaped by their environments and they really get under the skin. And so I don't have my pointer, but Those kinds of social determinants are things we've been talking about, focused on housing, but a lot of other things as well as environmental toxicants that occur in children's lives. And the way that they get under the skin is really of importance to understand in order for us to intervene better and help buffer children's health and promote positive health. So there are lots of different pathways. Stress is a primary pathway. We see this in young children. I always talk about 0 to 5-year-olds. And we see that in their emotional development, cognitive development, those sort of more mild indicators Carla was just talking about. And this has been linked to lots of different health outcomes, both during childhood, so the little 4-year-old, and also in their parents and adults. So we know that more adverse childhood events, as we call them, are associated with poor adult health. Good news is that parents can help buffer some of these effects. And so there's sort of 3 primary pathways that I often talk about, thinking about 0 to 3, 0 to 5-year-olds. One of these is caregiving relationships, so those early back and forth relationships between parent and child that build what we call early relational health. That's really important context for early child development. Also, parent and family modeling of kind of healthy behaviors. So we have an example of making food together and going out and exercising. You'll notice those are both in like lovely, beautiful homes and neighborhoods, right? So this is something that we recommend all the time, and yet it can be hard to achieve for kids who are living in suboptimal circumstances. I also want to highlight that it's important for those things to happen ideally regularly, right? We always say have family dinner together every night. That's very difficult to do, but this is something that's particularly challenging for families who are living in an unstable environment, as Jen and others pointed out. So we know that families can face challenges, and I think one key question is, how do we develop systems that work better to support parents so that they can support their children better? And housing is something we've certainly been talking about this afternoon, a critical foundational context for child development. And one of the things that I often say is that phrase about like putting on your own oxygen mask before helping others, and that's how we can, I think, phrase this or frame this to parents. And first we need to start really by saying, okay, parenting is hard, parenting is challenging and stressful, and parents need support. I think this became really highlighted during the pandemic when, for example, childcare went away and other things, and it was, of course, always there. I think we can all appreciate that in this room, but I think that's also really important to always note. That was always there. And the pandemic really heightened our awareness, our collective awareness of it, and hopefully it will last. And I'm very happy to hear about the policies that HUD and others are doing to hopefully promote these supports for parents and families. In thinking about how we do this, we want to really think about asking parents and families what they want, what they need, and reaching them where they are. So we've also heard a little bit about this in these talks. Be flexible and respectful, have cultural humility, and build relationships with the communities, and in this case, the parents and families we're trying to reach and work with. I also always say that parents are really the experts in their child, and I think we can also extrapolate that in this context to say they're probably also experts in their neighborhoods, and they probably also know a lot about what they need, what they want, what their strengths are, what they're looking for, what they'd like to enhance about their neighborhood, the different networks that exist to already support families in the neighborhood. Okay. And so in terms of asking families what they want, one project that we worked on that was actually based in a Healthy Homes group in Grand Rapids in Michigan, looking at lead prevention, was oriented around this COFI, or community organized around family issues model. And so it was a peer delivered by parents and grandparents actually, lead prevention program in the home setting for 0 to 5-year-old children. And so we're continuing to work with that agency, and they're really wonderful. And I'd just like to point out there's a COFI group in Washtenaw County, which is the county we're in now, called the Trusted Parent Advisors. And so they're a really great group of parents who say, we know the issues that are facing our community, and we're a group of parents who would like to be activated around this, and we know how to get there with your support. Another thing, so that's asking parents what they want. Reaching families where they are is another thing, and Jennifer did such a great lead-in around pediatric medical homes and social needs screening, which is something that we've also been working on. And pediatric medical homes are really that idea of sort of the one-stop shop in a community setting where children will pass through, hopefully with their parents, at least when they're 0 to 5, and they receive different services, among those social needs screening and supports for building that early relational health. Other places that are really important for reaching kids and families, childcares and preschools. I work a lot with Head Start and Early Head Start. I just want to give a little shout out to Pop-Up Safety Town because it's based in pediatrics and it's happening this spring, and this is basically going out in communities that don't have a standing place to do Safety Town around injury prevention, and they're going into the communities and reaching families and kids in those communities to do Safety Town, and of course home visiting. I also put on their libraries and laundromats because these are maybe unexpected places where one can reach parents, but where parents are, and where parents are often with their young children because they don't have childcare sometimes. I'll just say one thing about our Healthy IPSI project, which is based on the social needs screening with a local pediatric clinic. We were really interested in talking with parents, pediatric providers, and also community-based organizations about, okay, you screen families for social needs, then what happens, and how do we sort of facilitate connections in the community where parents and families can reach, can gain the services they need. So that's a Healthy IPSI study, and there's some posters around the room about that. And I just wanted to end by saying, I think we all can inherently know this, but we do know that sustaining especially young families where young children are living can really promote healthy neighborhoods across generations, and I think that's a good goal. So thank you.
I want to thank all of our panelists and Secretary Todman. We're now going to open this up for questions and answers from the audience, and we have some that were submitted ahead of time. Secretary Todman, if you would please join us. No? Okay. That's fine. Let's, there's some microphones that are going to be circulating around if anybody from the audience has questions. Meanwhile, while we're waiting for questions, I have a few questions that were submitted earlier. And maybe I'll start first with Dr. Miller, if I could. So how do you think neighborhood design can address mental health concerns, especially adverse child events in children?
Okay, this is on.
Yeah, I think so.
Yeah. So designing neighborhoods. One thing that I'd like to advertise is that one of our colleague groups in the School of Public Health that works on violence prevention has actually found evidence, data to show, backed up by objective sort of gun violence evidence, that if you do greening initiatives in neighborhoods and sort of focus on the care and tending of the actual physical neighborhood, they've actually found a reduction in gun violence in those areas, sort of block by block. And so if we think about that, not only could children be sort of getting out to play more in a clean, environmentally less toxic neighborhood, gaining physical activity, but also if we think about violence in violence neighborhoods, there's a lot of data also to show not only is gun violence certainly an issue in itself, but it also does things like disrupt sleep, and sleep is really foundational for child development. So we can take sort of the neighborhood approach to addressing neighborhood factors like that through a relatively simple clean and green type initiative, and that can have lots of rippling benefits, as one example.
Terrific, thank you. If anybody in the audience has questions, feel free to raise your hands. There's some microphones around. Meantime, I have another question for Jen ERB-DOWNWARD. So considering the existing research on the impact of neighborhoods on child health, how can policymakers effectively collaborate with community stakeholders to implement policies that address disparities in access to resources and improve the health outcomes of children living in disadvantaged neighborhoods?
Sure. So I think one of the really big things that I've found working at Poverty Solutions is that often there aren't enough conversations going back and forth between the people who are impacted, the community organizations who are actually going to be the ones who really need to be doing the advocacy to really push policies forward, and researchers. So there's often sort of this lag in terms of time frame. And so I think a couple of things are really important. From where I've seen policy impact move forward is when you have both access to research in a timely manner that can provide the numbers that are needed by the advocates and community members who know what's happening on the ground. And then from there to shape the policy based on that information. And then you actually can see things move forward and go from that type of partnership to actually getting a bill through the legislature, whether it's state or federal. It always takes a lot more time than you want it to take, but it really is that communication and recognizing the strengths of these different groups. You really need all of the parties at the table to actually move things forward effectively.
There's a question.
Yes, hi everybody. Thank you so much for these wonderful talks. I really appreciate it. My name's Toby Lewis. I'm a pediatric pulmonologist, a specialist in kids' lung health, and also do environmental epidemiology, and I've had the pleasure of working with a couple of our panelists. My question for everybody has to do with the tension between working in our silos and getting very detailed, specific information in our individual areas and taking the more holistic view. And this question really arose back when I was doing Healthy Homes work, doing work trying to improve indoor air quality to help kids with asthma, and thinking, we're in these homes, this would be a perfect opportunity to work on lead or injury prevention, but our money and our mission is all about focusing on air quality and asthma. So as I listen to everybody talk, like, we all recognize the importance of housing and how it has so many impacts in so many domains. And on the flip side, on the funder side, there's health money, there's housing money, there's energy money and weatherization and housing improvements from that perspective. And it just seems like there's an opportunity right now to try to compile a broad index of all the benefits that can come from living in a stable, healthy home in a nourishing environment, and then somehow use that to foster the collaborative efforts across government agencies so that there are more holistic programs out there. So I'm just wondering other people's thoughts on this and suggestions of where we might want to take this.
I mean, I guess I'll have one thought, and that goes back to, I think, something the Secretary was saying earlier, which is thinking about some of these different pots of money. What is guaranteed funding? What is funding that is discretionary? Where do things like that exist? So I would start with that sort of what are the different pots of money and policies that exist and how can they be leveraged? And I think the next thing is really to think about self-interest. And I know that sometimes self-interest gets like a bad name. It's, we should all be, caring about what happens to everybody else, but every single organization has self-interest. And they're only going to act fundamentally based on their self-interest. And so when we're framing an argument for why someone should do something, we can't just frame it as we do this because it's the right thing to do or it's going to be good for children's health. Maybe that's not their priority. They care about it as a person, but it's not why that organization actually exists. And so what we need to be thinking of is, for whatever issue we're concerned about, if we're thinking about how do we bring these programs together, how can we frame it in the context of that organization's primary issue? What are they getting their funding? What is it that they're actually accountable to at the end of the day? And then how can we tie that in as many ways as possible to money that's actually fixed, that has to be paid out? I know that's a lot harder than it sounds, but I think that kind of thinking is going to bring people together in a more sustainable way than partnerships that are based on good intentions.
I mean, I would suggest that one of the things, this is one of the places where thinking about neighborhoods could be to our advantage, right? If in fact, I mean, your point was there are sort of these isolated initiatives, both in terms of research and then how it gets to speak to the policy world, whether there's a feedback effect. If in fact, researchers at the U of M, for example, were to say, let's identify a neighborhood together, right? I'm entering it through the air pollution. I'm looking at mental health. I'm thinking about housing and lead, right? We may be going for different pots of money, but the focal consideration is a shared neighborhood. Then there are ways to think about the complements between the research we do, and then we also have a stage for making a case for more integrated policy intervention, also working with the individuals in the community around activism and the like. But it would require planning ahead of time, identifying a really progressive site, an important site for that work, and then creating a complement between our research, grant efforts, and the research that actually gets conducted.
My team is this on? Hi, my team's gonna hate me for this, sorry guys. But one of the things I strongly recommend is at the federal level, we coordinate all the times and try to remove the barriers and try to find ways that all of our funds can work together. But it's theoretical for us because we're the federal government in Washington, D.C. Where I think it's really critical is at the neighborhood level or the city level and the county level, and talking with all the different systems I mentioned earlier, the ones that they've mentioned, talking to your planning department, insisting that local leadership is thinking about these interventions holistically. How that helps folks like me is that when our money begins to bump into each other, where HUD says X, but HHS says something else, that should come to us and say, these programs would work so much better together if HUD were to remove this requirement, or education were to think about this differently. That's the highest value I've received in my national perch, is when localities are working really tightly to each other and raising that up to us. And I'll say that our peers across the federal family, the one thing this administration did was put together a lot of people that fundamentally like each other. So we think about this all the time on your behalf. So I would say it sort of goes up and down the scale.
I love that. And I'll just follow up to I was reflecting in this conversation in our Healthy IPSI project, which is the neighboring town. This summer, we ended up talking with a range of community-based organizations. And one of the consistent themes was sort of like, well, we know what we do over here. We sort of know what these guys do over here. We should find out more about what they're doing in order to sort of connect families with services. And there was sort of surfaced a need for some information sharing. And there's actually a great website called Find Help that kind of, you can go punch in your zip code and find services, and it's actually integrated with the medical record. And so we were like, oh, that's really exciting, but then people weren't using it. So there's all sort of course, as we can imagine, lots of different barriers and constraints, but that idea of sort of building knowledge of what your fellow agencies are working with, all on behalf of the neighborhood or the family or the community that you're serving, and then also figuring out ways to coordinate and ways that, or identifying pinch points that make it more difficult, and then bringing it to the higher level and saying, we need to fix this, would be great. So, yeah.
Thank you very much. Amy Cohn from Industrial Engineering and Michigan Medicine. As I've been listening to all of this wonderful conversation, I've realized my own bias keeps bringing me back to thinking about urban neighborhoods. And to the Secretary's point, we are considering children who live not only in urban but rural communities. And so my questions for you all are, number one, unlike an urban community perhaps where it's pollution tied to traffic, where it's congestion, where it might be violence issues, what are the challenges for rural children? How do we address those? And perhaps most importantly, how do we make sure that that population of neighborhood does not get left out when we think, as I have been, with this bias towards inner cities? Thank you.
I was thinking they have to ride on buses for longer, so I was thinking of Sarah's work. But certainly a hollowing out of services and schools and hospitals and things that are those anchor institutions have happened in rural areas. And I reflect that Michigan is a really great state in terms of having all of those different settings present so that we can engage those communities, but it's really hard. And as I think a lot of us were saying, it looks really different in rural communities compared to urban communities. I don't know if other.
I mean, I just really appreciate the question. I think there's a growing interest in understanding that rural areas have their own unique challenges and, need our closer attention. I mean, I can just think of a few examples. So, we do research on mental health benefits of green space, for example. But green space in a rural setting is not the same as having green space when you're surrounded by brick and concrete and high rises. And so making sure that you're doing things thoughtfully and nuanced is important. We also think a little bit in terms of different sources of exposure from air pollution. So we've done some recent interesting work in rural areas. We're seeing agriculture use, for example, has some interesting impacts on the brain. Now that was in the elderly, but actually I wouldn't be surprised if you see something similar in children because of the way we use pesticides that are neurotoxins for things. So I think it's really important. It hasn't been as well studied, in my opinion, as it should be, but I appreciate that comment.
I don't know if there's any research on here, but we do know there's news accounts of the extent to which industrial farms that are often found in rural areas affecting migrant children or low-income folks who are near the farms due to the spill-offs and the like, and we're seeing all kinds of health consequences that seem to be associated with the spill-offs and that. And if we think about education as a health issue, an indirect health issue, you were kind of joking, but not. But the commute and the consolidation of schools in rural areas is a real thing, and it's problematic not in terms of the strain of the children getting to school, but the reduction in rigorous curriculum because they can't sustain it financially. So what does that mean for higher education options and the generational effect on wealth and health and all those kinds of things?
And I'll just add that, one, I appreciate the question because I think it gets at something. I came back to Michigan about 7 years ago after living in New York City for a while, and I'd been doing work around housing instability and homelessness in New York City, and I wanted to do the same kind of work here. And so I started talking to people just to find where were the gaps, where might I be able to fit in. And the first thing that everyone said to me was like, oh, you're interested in homelessness, you should go work in Detroit. And I do work in Detroit, but I'd mapped out the data across Michigan, and what I want to tell everybody in this room, the highest rates of housing instability and homelessness are in rural areas in the state. Part of that is because there are undercounts going on in some of the urban areas, but that doesn't decrease the counting that you see in some of the more rural areas. So I think that we have a bias about what it looks like to be struggling economically and what that means. And our bias is towards urban areas. And then when we think about programs, we tend to develop programs that are designed to help people in a more densely populated area. And that means that those same programs don't function in areas where the program requires density. So we really need to be thinking about things like transportation. How are people getting from point A to point B? People don't have money for gas necessarily. They might not have money for heating. What are these other issues? So I think a lot of it is shifting this frame and then also really concretely asking ourselves this question of sort of the density of the program. Is this program going to work in a non-dense area? And then also thinking about what are the institutions, those anchor institutions, schools, healthcare centers, often religious organizations are the places that exist in rural communities, and going to the communities and finding out what are these organizations, where do people go? So I think that's a really critical question, and we need to be doing more work in that area.
Great, thank you, everyone. That's about all the time that we have. Those are excellent questions, and thank you to all the panelists. I'd like to move on and thank thank Secretary Todman for her talk and for the response and to all of our panelists as well. And to everybody attending today for such a robust discussion. It's easy to see the many threads of research and threads of opportunity and certainly policy implications of all of this today. So for the final part of our event today, I'd like to introduce our final speaker who will provide some concluding remarks. It is my great pleasure to introduce Dr. Kathleen, and I suppose you can have a seat down. Thank you very much to all four of you. And so now it is my great pleasure to introduce Dr. Kathleen Cagney. Dr. Cagney is the director of the Institute for Social Research and professor of sociology at the University of Michigan. She works to examine social inequality and its relationship with health, focuses primarily on neighborhoods, neighborhood context in the life course. So please join me in welcoming Dr. Cagney to the podium.
Thank you, Jeremy. Well, I hear the little tinkling of the reception behind us, and I know that I am holding you from that, but I would just like to take a few minutes to speak broadly about neighborhood context, to draw on our recent panel on Secretary Todman's work, and to help us think through what are the fundamental questions related to context and child well-being. So I wanted to both express my gratitude to Secretary Todman, as I said, to our panelists. Wanted to give special thanks to the staff of the Susan B. Meister Child Health Evaluation and Research Center, and special thanks to Susan for realizing the CHEAR vision, and also to Paul for suggesting that last year at this event that ISR be brought into the CHEAR fold. And so we are so happy to be a part of this event and a part of this community. So, I think in summary, what we've learned today is that neighborhoods do indeed matter for the well-being of children. Even with concerns about selection, my colleagues, particularly in the Department of Economics, like to think through the question, is it that people with similar characteristics select into a neighborhood, and is that actually what we're observing? Or are we actually observing that something happens in the neighborhood context itself that affects the outcome? And I think we see evidence today of that latter principle. And I want to include a bit from the social sciences as we think through neighborhood social context. And one example nicely comes from research supported by HUD, the Moving to Opportunity study, where vouchers were given to families to move from low-income neighborhoods to higher-income contexts. And that work suggests that they do see effects in the well-being of children across a range of indicators, and that the larger the dosage, and dosage means the time spent in that neighborhood, the greater the benefit. And this is work by Chetty, Hendrig, Ludwig, and others. And I see the secretary nodding, so she knows this work well and why it mattered. But one of the fundamental questions is, what exact things about a neighborhood do matter? So we discussed today things like safety, schooling, clean air. And we have heard important arguments about housing stability and other forms of inputs. But I think it's important to realize that there are different levels at which these processes might operate, and we also discussed that too. The individual, the family, the school, the peer group, lots of evidence that peers matter in terms of all the kinds of outcomes we talked about today, how they intersect. So there's great complexity in the modeling of these kinds of, these sorts of outcomes, or the kinds of covariates we'd like to think about. And they may operate differently at different stages of the life course. We didn't speak a lot about development, but you can imagine for infants, toddlers, young children, adolescents, the extent to which neighborhood matters could play out very differently. But I think a fundamental principle here is how does it actually work, and what are the mechanisms that lead to safer streets or to cleaner air? What are the things that link a particular kind of input to a particular kind of outcome? So I'm going to bring in a little sociology here. That's not a surprise, I know. But wanted to think about some fundamental kinds of processes that we think of as mechanisms in neighborhoods. So social cohesion, collective trust, informal social control. We think of these as emergent properties in neighborhoods. They're not divisible, they're not individual characteristics, but things that come together in our microenvironments. This notion that your neighbors would have your back. There's actually a question within neighborhood studies. If a fight broke out in front of your house, would your neighbor intervene on your behalf? And that is more predictive of a number of health outcomes for children and adults than any kinds of composite measures of neighborhood social well-being. Rob Sampson, a colleague in sociology, was at Chicago, now at Harvard, was a pioneer in thinking about how concepts such as the one I just described